Secretary, Ms. Amulya Rao, introducing Dr. Preetha Reddy and Ms. Meenakshi Ramesh.
Good afternoon, ladies. Today we come together to celebrate the tremendous contributions of women around the world over the last tumultuous year. Women have helped immensely in the effort of recovery from the COVID-19 pandemic, alongside staking their claim to a more equal future. Women stood and continue to stand at the front lines of the COVID-19 crisis as healthcare workers, as caregivers, innovators, and community organizers. They have also been amongst the most exemplary and effective world leaders in combating the pandemic. The crisis has highlighted both the centrality of women's contributions and the disproportionate burdens that they carry. Women leaders and women's organizations have demonstrated their skills, knowledge, and networks to effectively lead in COVID-19 response and recovery efforts. In 2021, there is more acceptance than any time in history of women's equality, not just in the workforce, but in society as a whole. Women are recognized for bringing different experiences, perspectives, and skills through which they make irreplaceable contributions to decision-making, policies, and laws that work better for us all. The effective participation of women and equal leadership opportunities are now recognized globally as key drivers to achieving sustainable development. To discuss further on this topic, it's my pleasure to introduce Dr. Preetha Reddy in conversation with Ms. Meenakshi Ramesh. I'm sure that everybody in this room is aware of Dr. Preetha Reddy's many accomplishments, but please allow me the privilege to highlight a few of them. Dr. Preetha Reddy is the Executive Vice Chairperson of the Apollo Hospitals Group, Asia's foremost integrated healthcare provider. She is widely recognized for her contributions in making high-quality healthcare accessible to millions in this country. She works closely with Apollo's over 9,000 clinicians to introduce contemporary protocols to continuously enhance clinical outcomes. She leads the thrust on quality improvement processes to achieve the highest standards of patient satisfaction. She is also the managing trustee of the Apollo Hospitals Education Trust, a principal body steering the educational endeavors of the group. In addition, Dr. Preetha Reddy works with industry bodies and the Government of India to advance policy decisions on healthcare. She was a founding member of the Quality Council of India and is now president of Nat Health for the year 2020-21. Committed to service, Dr. Preetha Reddy provides leadership and direction to several social projects like Sachi, which is Save a Child's Heart Initiative, which supports diagnostics and treatment of underprivileged children ailing from congenital heart disease. In recognition of Apollo delivering outstanding medical care during the COVID-19 outbreak, Dr. Preetha Reddy was awarded the Economic Times Businesswoman of the Year award. She was also conferred with the Healthcare Personality of the Year award by FICCI for her far-sighted vision, exemplary work, and notable contributions to the fields of healthcare and social science. She was conferred the ABLF Award for Business Courage by the Asian Business Leaders Forum, and she is also a recipient of the Lifetime Achievement Award for Distinguished Service in the field of social science, conferred by the Loyola Forum for Historical Research. Last but certainly not least, Dr. Preetha Reddy was conferred the degree of Doctor of Science by the Tamil Nadu Dr. MGR Medical University in recognition of her outstanding work in the field of healthcare. I was going to say, please join me in giving a warm welcome to Dr. Preetha Reddy, but you already have done so. She will be in conversation with Meenakshi Ramesh. Meenakshi is the Executive Director and CEO of United Way Chennai, an organization that carries out holistic and sustainable interventions across Tamil Nadu in the areas of education, health, environment, livelihood, and disabilities. She is also a co-founder of Citizen Matters, an urban knowledge platform that brings citizens' knowledge and data together for civic change. Meenakshi has spent over 7 years working with Pradham, India's largest NGO in the education space. An alum of IIM, Meenakshi uses her managerial skills to bear in her work both social and civic causes. Though she has worked with and now heads an NGO, she strongly believes that individual initiatives matter as much as collective effort. Living that ethos, in her spare time, she enjoys volunteering for local cleanliness drives and other civic initiatives. She and her husband Ramesh are active supporters and mentors of young entrepreneurs and startup companies. Please join me in welcoming Ms. Meenakshi Ramesh. Thank you. Before I hand over to Meenakshi, I do request for everyone to please put their cell phones on silent, something that we haven't said for the better part of a year. But please do so. And Meenakshi, I hand it over to you.
Thank you, Amulya. Thank you very much. It is indeed an honor to be here this evening. I've always, whenever we've met Preetha at a social event, I've always wondered what it would be like to ask her about her journey and some lessons in leadership. I never imagined it would be in a setup like this with so many leaders in the audience themselves. But thank you very much for this opportunity. It is truly an honor. Thank you for being here, and I think we're all looking forward to a very invigorating and enriching dialogue today.
Well, I hope we don't disappoint them.
No, I'm pretty sure. Because we just heard what Amulya read out. I mean, it screams leadership in every sentence. So it's just amazing that you wear so many hats, you think about so many aspects. And there I want to just quickly draw your attention to one slide that Rinku's presentation had. It was Dr. Muhammad Yunus who said, "There is no going back. Prepare for a new future." So I would like to ask you, and please feel free to, I would love for this to be really about your journey. And if I butt in at times, please excuse me. But otherwise, we'd love for you to share with us, and then we can make it a little conversation. And I will be, Divya will be sending me some questions that Zoom viewers may be having. So at some point, if we can just take a few questions from the audience or from, I hope that flow is okay with you?
Yeah, whichever way you want.
Thank you. So I'd like to ask you, clearly your leadership in this unprecedented crisis has been something that the world has recognized, business leaders have recognized. You are at a unique junction as a corporate leader, as a woman leader, as an example to so many people in this country and in the health space. And from your viewpoint, what is leadership going to mean in the coming years? Is it truly never going to be the same again? What changes do you think we're going to make in the way we act, we think, we go about our daily lives?
So, as Indians specifically, we're quite philosophical. And the Gita talks about being a karma yogi. Can you hear? Am I okay? So, we just do what we have to do because there is a need. And it happened with the Apollo story. My father was in the US, and 4 of us good little girls grew up in the US. And he would write in Telugu to his father, my grandfather, saying, I did all this, and I had an institution, and we've done some exciting stuff, so on and so forth. And one fine day, my grandfather wrote to him, and he said, how does it matter to me? Because what will I tell them in my village that my son is in the US and he's doing these things? It doesn't really make a huge difference. And I think that got my dad thinking. So he came back with 1 wife, 4 daughters, 1 car and a washing machine, and moved back to Chennai because, Chennai is near Aragonda where we come from. And he started this practice, and he couldn't even afford a secretary. So, there was half a secretary because the other doctor paid for the other half. So having said that, it just happened because it was, there was a need, and my grandfather told him, listen, you need to come back, and then this happened. Then there was a patient who died because he could not afford to go to the US for a cardiac surgery, and it was like, we need to do something. And so then the whole Apollo story happened, laws had to be changed, legislation had to be changed, and so the story just kind of grew in a way, but the underlying philosophy and the ethos of it is that, you really need to do something about it. And then the 4 of us started working, and honestly we worked because it was hard to see your dad, and we were all good daughters. So we said we were daddy's good little girls, I guess. We keep telling him that, cheap labor. But we worked with him. And we enjoyed every moment. So, sometimes my mother says, you people don't know anything. You don't even talk about the children. It's only about the hospital and work. Because honestly, I don't think we know too much beyond that ecosystem. So that happened. And again, it was always a need, the pharmacies happened because there were spurious drugs. And, how do we get drugs of quality to our people? So then my sister started that chain. Then there was the whole digital enterprise now, which we started. because we know it's changed to a digital world. But in the COVID situation, and I think that was an eye-opener for us, that we realized that there was just so much to be done. There was systems to be brought in. The protocols of treating somebody when there was a crisis. And honestly, when we look at our data, the first 30 days, outcomes were not that great. Next 60 days, it got better. 90 days, so much better. So, we were monitoring data in such a way, and we knew that at the right time, right intervention, literally the cocktail of drugs made a difference. So I think every time somebody does something because there's a crying need in society, you come up, you intervene at the right time. So, there's a song about saying, what I do it all for you. And I think that's probably the philosophy of most people, and it's not just me, I think it's everyone here, that you do it because there's a need, you do it because, you really feel you have to do it. And to me, I think that's really what, right thing. Yeah, that just goes back to our, Indian philosophy of, there is a law of karma, you do what you have to do. The fruit of it will happen, you can, I think everyone is successful. If you go to bed feeling like, I've done something, it's successful. And I want to ask you all a question since we're all here together. And this is how, I think COVID has changed people's thinking. How many of you in this audience would love to be powerful? Can you raise your hands? I mean, you can. It's not that you can't. So how many would love to be powerful? And how many would love to be beautiful? All the hands. Yeah. And how many of you would like to be rich? I'm okay with yeah, but then there's no equation for rich, right? You don't know what that is. That's just a moving target. So there were multiple things, and this was really, you have to think these things through. And it's really about how many of you want to be impactful.
Yes.
So that's probably the answer. In all our lives, you can have all this because literally it's in the mind, it's in the beholder, it's in whatever. And it's all about being impactful. And if you're impactful, it answers all the other asks. And I think this is what has changed during COVID. This is what leadership in COVID is about. And if you really look at it, it's like, how do you make a difference? How do you make an impact? So it's all about being impactful. And I think that was my lesson.
How lovely. That's what I learned. No, that is really a beautiful way of putting it. But I want to quickly touch on something you said in between. And while you said it was cheap labor, I think it was just beautiful that you had the 4 sisters. And I want to ask you to share with us, what is it like to be with your sisters? And one thing I've heard is that the 4 Reddy sisters always play upon each other's strengths to reinforce each other's strengths. Tell us how it is, how does the dynamic work, how beautifully the 4 of you work together to strengthen it's not 2 plus 2 is equal to 4, it becomes 2 plus 2 is equal to 6 because each other is sort of feeding off each other's strengths. Tell us a little bit about the sisters.
I have to give my parents credit for that. And so my mother, we love this. So she gives each one like a goddess avatar. So Sunita handles finance and strategy and all that piece. So she said, okay, she's Lakshmi. And then Sangeeta is, she's really the wise one. Even though she's the youngest, if I had a problem and I had to think something through, I would go to Sangeeta. And, she was incidentally the president of FICCI and did a great job. So Sangeeta is really the Saraswati in the family. And Shobna is the one who's, she's very entrepreneurial. And she's started things and she's grown it, she's fought for the right things in life. So, so my mom would call her Durga. So then that left me and I said, Mom, so what am I? She said, well, you have to look after everybody, so you're the Parvati. So this is the joke in the family. And so that's how we morph into each other's roles. And, between us, we have 10 kids. And we have 4 grandkids because we share them all. I don't know if they love it, but anyway, we do it. And so having said that, I think each of us has a strength. someone just holds things together, the other one builds, the other one strategizes, and the other one really has the wisdom. And we realize to call on each other's strengths. Otherwise, if we feel each one can do it ourselves, there may be chaos. But if we realize that someone else is actually better at something else, I think we draw from each other's strengths. And we've learned to do it, and I think the credit goes to my parents, because I think my dad knew to pull the strings very well. He would know exactly which one would deliver on what he wanted, and he would just go and then he'll say, by the way, keep your sisters informed, so that was his ticket. My mother would brook no nonsense about any dissent in any place. So while she's gentle and she's beautiful and she's kind, she's very tough on ground rules. So that's what happened, and that's where we are.
It's lovely. I think it's great to hear that from her. For all of us who have sisters, I have two younger sisters. I wouldn't want to have it any other way. This is just really forces out.
If you are the eldest, remember to share your clothes and the children and everything else except your husband.
My sister very kindly actually gifted me a little thing that's still on my wall saying, "A sister and her wardrobe are forever." So
I always pack 3 extra, because I know one sister of mine, Shobna, will say anyway she would have packed, I don't need to bother. So we've grown up like that.
Right. But tell me, Preetha, I want to change gears a little bit and ask you how your inspiration and how the way that you show to the team at Apollo and the many organizations that you have enriched and spawned in the enterprise, how has this last 1 year's journey and maybe the journey before that been for the women in the team? I'm trying to say this in the context that for a lot of young working women, young mothers, young professionals, the pandemic has been really bad in terms of just the time that it takes for them to sort of, get rid of, get home organized, be there for the work meeting. Is the load being shared equally between spouses? How do you think it pans out for younger women? How do you think we leaders who are sitting in this room, what advice would you give us that we take inspiration to make the journey easier for younger colleagues, for younger women?
I'm in total admiration of the way I've seen it within our teams, but I've seen it in multiple organizations about, especially during COVID, how people are literally frontline warriors. And those who, don't have the opportunity to work maybe in the hospital system or frontline, they still do a lot from, the thought, from the back end, small things, but I think they do a lot. How do the women cope as against men, especially women who are working? To me, a lot of it is in the mind, and in the fact that, they just make a statement saying, I'm needed here, I have to do this, and they were out doing it. Because a lot of our workforce, 85% of our workforce are actually women. And they just literally dropped everything and they did what they had to do. They hadn't seen their children. Their husbands were sometimes at home because they were working from home. Food really did not matter at that time because, that was just by the way you eat to exist. So I think the priority shifted so much, and the men in the house didn't mind doing what they had to do, which was technically considered something that the women would do. And the women were out there battling because it was, they were required in the front lines. And to flip it, supposing there's a war and the soldiers have to go out, the wives at home are not really saying that, this is my job and that is yours. It was kind of understood. I saw during COVID that the women were out there, frontline because the nurses are women, a lot of doctors are women, and the men were like handling it from the back. So the story kind of flipped, but people just, they were so selfless in their giving, in their sense of duty, in their sense of sacrifice. So I think I get tearful when I, really think of the kind of stuff which has happened over the past 1 year. And the whole priority has shifted. What was so important same time last year ceases to be important today.
One can't even think of what we were doing at this time last year because everything seems to be almost another lifetime away, right? Oh my God, did I really do this? in March 2020, it seems like a few years ago.
It's changed.
Absolutely. Priorities have changed. But do you think it has made things easier for women in the average woman in the workforce? Yes, I hear you say a resounding yes for the people in your team and in the hospitals. Do you think that by extension it's likely to happen for women in other fields perhaps? Do you think COVID and the whole work from home and the pressures that it put on families is likely to make it easier for working women?
The India which we have, and it's probably the same even for the developed nations, that it's different worlds. I think today's paper spoke about that Kannagi place, that slum, which, the women
the
are
hidden
like,
truth.
the hidden truth. And that's also during COVID, that is women. And on the other side, in the IT and in the digital sector, the women are doing so well, and the work from home is actually working very well for them. The first round of the RT-PCR testing was a woman in a lab in Pune. So I think in different aspects of society, women have done extremely well. The women sitting here who I know so well, who've done so well during COVID because they've been innovative, they've been hardworking, and they've come out with some amazing stuff. So I think it works, and in different pockets of society, women have flourished and done well during COVID. But in some others, I think it's really been hard, and those are the aspects which worry and which really make me sad.
Right. I'm going to zoom out again a little bit. And from where you are right now, I'm going to zoom back and say, Rinku actually shared a quote with me, said, please highlight it and ask for Preetha's thoughts on this. It said, we have cracked the glass ceiling. We haven't managed to shatter it yet. Can I have your thoughts on that?
Yeah, so there's a World Economic Forum data which says that in the current aspect of gender diversity and the way it's going to be, it's going to take 202 years exactly, and this is all data extrapolated one against the other, to really have equality, or the women actually taking over men. So if we talk about shattering the glass ceiling or even cracking it, I'm not so sure, because there's stories of some who've done phenomenally well, but then that's not even 0.1% of the whole world. So I think it's just the mindset, the genetic way we are built, and it's kind of the attitude about prioritizing maybe. So it's going to take a while. But if we continue to say that we are equal contributors, but there is a yin and yang. There's no point us getting into male shoes or them trying to get into female shoes. But if we can learn to literally coexist, I think that would be an answer, because women must be given their equal rights. There are developed economies where women are not paid equally to men.
Right.
So, I would love to say that, the glass ceiling has been shattered, but I don't want to be very honest if I really say that.
Yes, there are some statistics which say how if today women were the ones who are in, let's say, claim that their time is really fractured so much that they want to step off the workforce, the world would be $180 billion poorer in annual GDP, because that's how much, even with their work from home, they contribute. So clearly, there is a lot of hidden effort which is not getting recognized. And you're right, the numbers about when we will reach gender parity and gender equality is very scary. So I suppose each one of us tries to make a difference in the way we make things better for everyone that comes into our circle, people that we work with, people that work in our enterprises, in our homes. Do you think government and civil society can play a more active role in this, at least in the Indian context, do you think?
I think India has a chance, very honestly, and the governments have a large role to play. Even today, I think, policies, a lot needs to be changed. While they talk about reservation, I think, it has to be equal opportunities for men and women, which still doesn't happen to the extent it should. But having said that, we also have to stop thinking that we're women and this is it and all that. You know, there has to be a level playing field. We need to be deliver as hard and as tough as the men do. Sometimes I see when you talk to other maybe retail, other industries where there's sales force, and the sales force will always be men, and it's like but only the men can do it, and it's and it's like why? So I think it's all a mindset issue. It's not really lack of capability from the women's side.
Absolutely, amen to that. Thank you so much. And I really think that point which you said, that if we want that equality, we have to punch to the same height, we have to deliver to the same capability, is a point that's beautiful and really well taken. I actually have a question here from, it's the audience of Zoom, Divya. It says, can you tell us of 2 leadership lessons that men can take from women?
Wow. I think it's to be supportive. Women by nature are more supportive. For whatever reason, maybe I would just put it to our genetic makeup. And if the men can be just a little bit more supportive of whatever's happening, it may be something small at home, it may be that the woman is working or she's hard pressed. I think that would be a great lesson. And partnership. Partnership is very important. I realize that the men always feel like, they have to pay the bills and the women have to keep a beautiful home, despite the fact that the woman is working and the man is working and so on and so forth. But if there's an equal partnership on, let's start with, paying the bills, for example, maybe a good lesson and a good way to start off. Just practical.
Yeah, practical pieces of advice, absolutely. I would like to end with my funny / rapid fire-ish questions for Preetha. So if there are some questions in the audience, we're happy to take. Or you can just, some of you have my number, you can text it to me and I can.
I think we have shared from the Zoom, but do you want us to take the audience questions right now or after some?
No.
If you have your questions, please raise your hands. And
I could say one thing. I've seen Preetha through the pandemic working so hard, and I think sustaining the whole system of the hospital through these months, all the months ever since, and you've been working every single day, which is the hardest, most scary thing I think anyone could have done. Go into that hospital at the worst time. What have been your waking and sleeping thoughts every day through this pandemic?
Vidya, what if I said I want to look like you when I wake up in the morning and be like you? But having said that, I think in the night it's a sense of gratitude. There's no going away from it, because it's just you just see so much and you hear so much. So it's like, thank God, so many people got well and so much was done. But really, thank God for small things. So I think it's a sense of gratitude in the night, and in the morning it's like, God, I wish I could lie in for another half an hour. But having said that, it's like you don't think about yourself, I guess. There's just so much to do, and how do we keep everyone safe? That happened. But listen, Vidya's a good friend, and she makes me look so good. But I think we've had our good times, and I'm grateful for that. And all of us have done what we had to do during COVID. You've kept your home safe. You've cooked some amazing meals for those who could cook. You've, maybe put some flowers on the table to make the house nice. So I think each one of us has done what we had to do. It's just that which environment you are, it's not big or small or whatever. It's just that you have to do what you have to do.
I love how she comes back to you have to do what you have to do, making it seem like all in a day's work. That's really amazing. I mean, we know how much effort there is, and then you make it sound so effortless. So that is really beautiful. Thank you for that. There is one more question. It says, how did you achieve work-life balance? So I'm assuming it refers to the time when the children were young. We did hear you say that 10 children, 4 sisters, so I'm sure that was a help. But the question is, how did you achieve work-life balance?
Honestly, I think I didn't think it through so much. that kind of helps. Sometimes you overthink and you overstress into a situation and you cause more anxiety for yourself. So it was like, and we were a joint family, and Sunita and me lived together, so our kids grew up together. One traveled, the other one was around. I think God was kind, they were fine, they grew up, and it wasn't this work-life balance, I don't have too much of theory or research, because I really think that, it has to flow like a river. And if there's a storm during the flow, the river will go around it and it will still flow. You can't really build multiple dams or do things like that. So work-life balance is all about the balance. The rest will just evolve and it will flow. So I'm not a great proponent of this whole thing about work-life balance.
Did all of you have a picture in your mind of a river flowing and the water going around it? So that says more than any theories, as you're saying. So, it will stay with people. Imagery always stays. So the next time somebody says work-life balance, we will remember this audience and we'll remember what you said. And that will be such an amazing piece of advice. So that's lovely. If there is any, there is one more question. Pinku, are we okay on time? Can I take 5 minutes for
Yeah. Hi everybody, this is Shobna. We were talking about leadership, and with the pandemic, everything is turning virtual. So, as a leader, how is your experience with this virtual thing ahead? Is it going to be virtual thing like that, or as a leader, how do you enterprise yourself?
So I think the whole virtual world has brought people closer together. So I think the geographical boundaries have gone. While you do miss the human interaction, and it's really nice to get out, dress, meet everybody, warm, yeah. So there's no going away from that. But having said that, in this year we got to virtually meet the kind of people we did, which we could never have dreamt of earlier. We've met heads of countries, we've met heads of state, we've had like the best brains in research talking to us, because and it cut down on people's travel time, it cut down on so much, so there's that much more time to give for research and for that kind of work. So I think that's been a huge plus, and that's not going to go away. Yeah. Because now we've learned that you can actually do a lot of work virtually and get done with it. So I think that's never going to change. For me, in the healthcare space, it's been path-breaking. On any given day now, we do about 3 to 4,000 medical teleconsults on a daily basis.
Wow.
And those are the numbers. And if we think this is huge, in the US and all that, it's more. So it's become a norm. Today somebody was asking, I'm somewhere, I need to come and see the doctor. And then the doctor said, don't bother to get on a flight and come. Huge effort. Just let's do this through telemedicine, and then afterwards if really required. So it's cut down expense, it's cut down costs. So many good things have happened. So that's the silver lining in these clouds. But we've learned to cope digitally, and I think that's been a huge learning.
Lovely. I have one more question from the audience, and then we'll go to, what do you think is the most, or one of the most important attributes that women should have, I'm going to say have/cultivate, to foster change in the world?
So this whole thing about I am a woman and I have to do this, and I think maybe that should change first. Really, honestly, we've got so many plus points. We look good, we can ask for things can get done. So let's look at the positive aspect of it. To me, again, forgive me, but I'm a healthcare personnel, and that's all we can think of. There is a large looming problem because we don't really know to look after our health, and this growing disease burden is huge, because the economic aspect of it is something which will, it can make or break a nation, for example. So there is diabetes, there is cardiac, there is the problem of cancer. So I think that one single thing women can really make a difference is to first look after your own health and teach the rest of the family to be healthy. And I think that's a commitment we owe to us, to society, to the ecosystem and the environment we're in. Because if you make that single difference in people's lives about just small things about being healthy, which also means that you don't cook these completely delicious unhealthy meals on a daily basis. So please do it over the weekends. But just small things I think will be hugely impact, and that's where we have to make a difference. Again, there's data in India, and we were talking about breast cancer the other day, and we said if 350 million women really, just do the self-exam, looked after themselves. The onset of disease, you catch it early, you can cure it.
And the prognosis
prognosis, so you're saving lives, you're saving the economy, you're saving costs, and you're saving that mental trauma in the family. These Bharat Naris are very sacrificing. I will look after everybody in the family and the whole world. I won't look after myself because I should sacrifice. But the problem is when you get sick, everything is shattered. They're all upset, crying, the kids are a mess and all that. So where's the sacrifice? It's a disaster. Yeah. So why are we doing this? So it's all a mindset thing is that, if you can really look after yourselves, look after the rest of the world will be a better place to live in. And please think of the environment. We can make that difference. And I think that's where we have to really think about it.
Wonderful. I think concrete pieces of advice to take home. Thank you so much. Yeah, Kavita, please. Yes.
Sorry about that. With COVID right now, we have so many new protocols in place, whether it's a hospital or travel. But things just seem to have gotten back to normal, especially in airports and public spaces. But what about in hospitals? Do you think this new protocol will continue? I think the protocol is a responsibility. And it will continue because if you look at, not only our hospitals, but most hospitals, they're now running again on about a 70%. One, there was a pent-up demand because people were too afraid to come. And the second is people really need to get done with whatever they have to be done. But the protocols help. So those are not going to go away according to me. But we have to become responsible, and the SMS, which is the distancing, the masking, all that has to happen. Yeah, that has to happen. We have to be careful because we don't know when it's going to end. It's going to be there for. I don't want to frighten anyone, but I think we just have to be careful because it's a responsibility.
But Preetha, I just want to add that to the credit of the protocols, I just read recently somewhere that while there is obviously the specter of COVID hanging around us, the incidence of other airborne diseases, flus and other things was really low in India this winter because people were all largely wearing masks.
They were wearing masks, the air was cleaner because, people were going out less. All that is true, and on flights you can pick up, you can pick up a virus very quickly. So all these things helped. Can we continue like that? Is a big question. But I think people can make choices.
True.
You can cut travel because of virtual. You can do with much less. You don't really need that amount of vegetables and food and God knows. So maybe we should produce less. So things like that, choices are important.
Thank you for that. I just want to quickly, so my friend Preeti calls these rapid-ish questions because I'm not really asking you rapid fire, but very short answers, just 4 or 5 questions. What is the most valuable piece of advice you have ever received?
Wow, that's a good one. Listen, I think is probably the art of listening is just so important because you miss a lot otherwise. So even if it's some very small maybe staff in the house, but I think the art of listening is probably my best advice.
One leader you admire the most?
My dad.
Why did I even ask? Lovely. One bucket list item?
I really want to do it, but I don't know how else to clean up the poem.
Good, we'll
I live on the banks of the poem, so it definitely is a bucket list item.
God willing, it will be on a bigger bucket list and we'll all get to do it. So that's a recent book or movie that you enjoyed, if you had the time?
I think that was the last Vermeer, which was about, somebody who copied this artist and sold it to the Nazis and made them shell out a whole lot of money. It was just so clever,
The last Vermeer.
Vermeer, yeah. Those of you who love art and who love very intelligent drama, it's super. It's a good movie.
If I asked your team what kind of leader you are, what do you think is the most frequent word that will come up?
Now that scares me the most.
Maybe we'll do multiple options and we'll say we know what
there are two team members here, so I hope they close their ears. But having said that, it's probably someone who can help get something done for the good of the organization would be the best. And maybe a little bit of a stickler for outcomes and quality would be nice.
A good thing?
I think where I work, it's very important.
Yes.
So if I heard that, I think that would be nice.
That would be great. I'm sure that is what you'll hear. I have no doubt about it. Okay. Just give me one word. What was the first thing that comes to your mind? Fitness.
Sunita Reddy. She's not here, but I hate exercising.
A hobby.
Hobby is creating anything which is nice and beautiful. So it's not necessarily art, it can be doodling or
anything creative.
Yeah, but anything which is visually appealing.
Grandparenthood.
Absolute joy, no responsibility.
A vacation.
Wow, Vidya? I think it was maybe Africa. Nice.
Success.
Africa. Being impactful.
On that note, thank you very much. Ladies, I present to you Dr.Preetha Reddy. Thank you so much. Thank you so much,
Dr.Preetha Reddy and Ms. Meenakshi Ramesh, for this sparkling and enlightening conversation. I now request our past president, Ms. Kavita Dutt, to give a small token of appreciation to Dr. Preetha Reddy. I request our past chairperson, Ms. Shobna Reddy, to give a small token of appreciation to Ms. Meenakshi Ramesh. Now, our Senior Vice Chair, Ms. Jayashree Ravi, would give the vote of thanks.
Ma'am, you mentioned about the number of teleconsultations going up between 3,000 to 4,000. So what was it earlier and when you
It was in the hundreds.
It was in the hundreds.
Yeah.
So, ma'am, it's teleconsultation. Are there any specifics that you can talk about, like there are no consultations for these kind of cases, any details that you have?
Most of the consultations are, for, let's say, acute pain, multiple reasons, and the doctors have to be so clever that they have to pick up that, it can be a dangerous or a, important disease. So it all depends on how the doctor deals with it. But the consultations have been across the board, from small things to sometimes major. We've had people going in for a stroke who've then been told to rush to emergencies. That's where it helps.
And also, ma'am, since the numbers have gone up from 200 to 1,000 now, have you also increased the number of doctors who will handle these kind of cases?
We've had to dedicate doctors to handle telemedicine. Telemedicine numbers முன்ன ஒரு 300 இருந்துச்சு 300லேருந்து இப்போ 5000 நம்பர்ஸ்க்கு ஆல்மோஸ்ட் டச் ஆகுது. அதுக்காக டெடிகேட்டட் டீம்ஸ், டெடிகேட்டட் டாக்டர்ஸ் இருக்கணும், சீனியர் டாக்டர்ஸும் இருப்பாங்க. ஒவ்வொரு வாட்டி ஹார்ட் அட்டாக் இல்லை ஸ்ட்ரோக் இதெல்லாம் சீக்கிரம் கண்டுபிடிச்சிட்டு அவங்கள எமர்ஜென்சிக்கு அனுப்புறது கூட chance kadikkudu. So telemedicine has actually become a very good thing now, and we do it through our Apollo 24/7.
Ma'am, these numbers we are talking about
Across India, across. Talk about FLO.
How comfortable are patients during this time?
They become comfortable. They understand and they get dedicated time with the doctor, so they're quite comfortable.
And also, ma'am, are there any specific age category of people?
I don't have that data, so I won't be able to answer that.
So today was about inviting Dr. Preetha Reddy to FICCI Flow. She exemplifies and personifies a woman leader, and we thought it very appropriate to have her today as our inspirational speaker at our final annual session over the last 1 year. I think women, as she had mentioned, have really garnered their strength and grown a lot in different ways over the last 1 year, and I think it will be a different kind of leadership for women, and Dr. Preetha is an exemplary example of that.
And this one, since you mentioned that this is the last event of the financial year, you should probably tell us a couple of events that happened the last 1 year in FICCI Flow.
So FICCI Flow basically caters to the learning and entrepreneurial needs of women within the organization and outside at the 3 levels of the pyramid. Right from women in corporate boardrooms to professionals who are mid-level, and we do a lot of outreach, which is women at the grassroots, but that is mostly outside. That is where our village adoption program, 4Cs, and capacity and confidence building programs, job readiness training, all that comes into it. In the past 1 year, given the fact that we were in the midst of a pandemic, health was one very, very crucial aspect, and we ended up doing a lot of programs on awareness, mental and physical health for our members, and outreach in terms of awareness and screenings for our adopted villages.
FICCI Floor function women and leadership patti discuss பண்ணோம். Women in every area of business have done very well, and they have also worked as frontline COVID warriors. During COVID especially, women have done a lot of work. நிறைய வேலை செய்திருக்காங்க, and அது நம்ம appreciate பண்ணணும். Womenக்கு equal opportunities, whether it is in the office, whether it is in the technology area, or whether it is in any aspect, womenக்கு equal wages, equal opportunities கொடுக்கிறது ரொம்ப முக்கியம்னு நாங்கள் டிஸ்கஸ் பண்ணியிருக்கோம். அப்புறமா விமன் அவங்க ஹெல்த் நிறைய சரியாக பார்த்துக்கிறது இல்லை, அண்ட் விமன் ஹாவ் டு லுக் ஆஃப்டர் தேர் ஹெல்த். ஸோ தட்ஸ் ஆல்சோ வெரி இம்பார்ட்டன்ட் மெசேஜ் ஃபார் விமன். Men and women have to realize on the partnership, true appreciation of what each other does, whether it's in a family or whether it's at work. I think they have to appreciate each other and draw from each other's strength. That was another point which we brought forth at today at the Flow event. But women are leaders in their own right, and women leadership chances கொடுக்கணும் and appreciate பண்ணணும். அது ரொம்ப முக்கியமான விஷயம். And I think in a country like India, the women really are a large workforce, and அவங்களுக்கு equal chances and opportunities கொடுக்கிறது ரொம்ப முக்கியம். Try.
It's good. Thank you.
Thank you.